but for my last semester per day. Hello, my name is Sastan. I'm a fourth year medical student at the University of Copenhagen. And as you can probably see from today's video title, tomorrow morning is going to be my first day of clinical placement, where I'm going to be at the Department of Cardiology and the subsequent 6 weeks at the Orthopedics Surgical Department. So I thought I will take you guys through this process. So I'm going to show you guys my first day tomorrow morning, where I will take you guys through what case I see on my first day and what patient interaction I'm going to have, and just generally what happens. So I will see you guys tomorrow morning on my first day of clinical placement. So I mentioned early on in the video that I was going to be at the Department of Cardiology this semester for my first 6 weeks. But for my last semester I was at the Department of Cardiothoracic Surgery, where I got to see a lot of interesting cases and a lot of surgeries such as coronary artery bypass. And I got to see lobectomies, where you basically had a tumor and then you remove the tumor and sort of some of the tissue which surrounds the tumor in the lungs. This is usually when you have a localized tumor which is not spread all throughout the lungs. Then I got to see a lot of PCIs, these percutaneous interventions, where you basically take a stent through an artery in your arm or your leg, and then you kind of inflate the stent in the arteries to supply the heart. So you kind of push the stent outwards with the balloon in the artery, so the artery's lumen is then kind of widened if the artery was narrow, so then you kind of re-establish blood flow to that part of the heart. But this department I'm going to be at now is medical department, so I believe I'm going to see a lot of pulmonary embolisms and a lot of pre-surgical patients to kind of assess if they are candidates for surgery. Then I'm going to see a lot of, I believe, like arrhythmia cases where patients have arrhythmia, different types, and then I'm going to do a lot of scans, different types of scans of the heart, CT scan and MRIs, and I'm going to do a lot of EKGs. Although when I was at the Department of Cardiothoracic Surgery, I got to see a lot of EKGs, but I did not do them. So I believe I'm going to do a lot more EKGs now. Being at the Department of Cardiology kind of makes sense. And then I'm going to focus a lot more of the medical therapy we can give, so diuretics and calcium antagonists and beta blockers and so on, these drugs and ACE hemmers. When I was at the kind of surgical department, then naturally we focused more on surgeries, but now I'm going to be at a cardiological department, which is kind of the medical side of treating heart diseases. So naturally I'm going to be focused more on the type of pharmacological therapy, medicine, which we can give these patients. So I hope this part of my clinical placement will also be very interesting, as my last placement was. And I will take you guys through my day and kind of share with you guys what case I will see. So hopefully it will be interesting. It is actually freezing cold and I have to go all the way around the hospital. So at this time we were just getting an introduction to the hospital. So we were just walking around the hospital and seeing the different parts and being told where we were going to be. I was reading up on the different patients' histories, so the reason they came to hospital, other diseases and treatment they've had in the past, what medication they were currently taking, symptoms, family history, and so on. This is something we do before examining the patient, so you have an idea of who the patient is and you make sure that you have the full picture. I had a few interesting patients. One of them was shocked while working, so he got an EKG done. Then I did an examination of him, in which I listened to his heart, his lungs, and saw if he had any burns, and asked him about his symptoms and so on. When you have a patient who is exposed to electricity, it is also important to ask about what voltage the patient was exposed to, what part of the body it was, the duration of contact, and if he had any cardiac symptoms such as chest pains, difficulty breathing, fast heartbeat, and if the patient was unconscious, amongst other things.